This is Chicago's very own WGN News at 9.
After a break, more support than a heavy-duty hiking boot. Doctors find a way to shore up athletes' ankles.
Thanks.
In tonight's Medical Watch, taking a stand against ankle injuries. A new procedure cuts healing time in half.
My ankles were a big problem.
4 years on the football field, and John Edwards' ankles were shot.
Started from a simple twist of an ankle, spraining of ankle, stretching, slight tear, and then completely ripped apart. No ligaments left in either ankle.
It's the same for soccer players, runners, and other athletes. Once the ankle turns, it gets weak and turns into a vicious cycle of injury.
Once a ligament is sprained where it gets stretched, then the joint is a lot looser and then you're more prone to re-injuring it.
And there is no easy fix, at least not one that promises a full recovery.
The traditional surgical procedures is to take the ligament, especially if it's torn, and just find the ends and sew them back together. And then you're hoping that you're sewing it tight enough.
But they weren't real confident on how to keep me walking. I wanted to walk and then be able to get more active.
It was the goal when Dr. Robert Lim developed the Lim Procedure. He's used on soccer players, NFL linemen, and elderly patients, all with the same success.
My procedure involves putting a specific soft tissue anchor into this bone here, and then I use a non-absorbable suture material to recreate a new ligament in the exact same position.
But it's better because the new ligament is wider, more stable.
I've had 100% success on every single patient I've done it on, and they've been able to go back to what I consider their pre-injury status.
You'll be able to walk and be able to exercise and run, and I'm doing all three.
The Lim procedure has not been tested in formal clinical trials, nor has Dr. Lim compared the results to more traditional methods of treatment. And since he developed this, he doesn't want other doctors to know how to do it. He says trust him and his patient results.